Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth, so I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Hello, welcome to Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart, your host, and we're glad that you're with us today. You know, in my practice, I've been treating sleep-related breathing disorders now for close to 10 years, and I really enjoy it. It's been significant. I'm very humbled and proud to be able to know that I've helped people sleep better, breathe better, and live better. And even in life-threatening situations where people have, moderate or severe sleep apnea and they're overweight, we can help them breathe better and keep them alive for their family, for their wife, or for their husband, or for their kids or grandkids. And it's probably the most significant thing that I've ever done, other than being a father myself, is helping other people live better and increasing their life span and their life expectancy, and increasing the quality of life during that time. Along my journey of becoming a sleep, breathing, and craniofacial development doctor, I have encountered many different organizations. I learned a lot. I've spoken all over the world on this subject. I've been able to learn from the very best. And several years ago, I got involved with a company called Vivos. And Vivos is a company that's worldwide, and their global mission is to not treat sleep apnea, but actually end sleep apnea. And it's a very lofty goal, and it's a company of which I'm proud to be part of. I am a clinical advisor for them, as well as a integrated provider for their type of treatment therapy. And in this organization, there are many people that have personal stories that work for Vivos, not just to get a paycheck, and but they have a personal reason for being there. And my guest today is just that type of person. And I had the pleasure of meeting her in person actually about 1 week ago. And it was a very powerful moment when I met her, because we immediately started talking about her story and why she worked for Vivos. And so today I would like to introduce to you all Mrs. Bri Reiser. Bri, welcome.
Thank you for having me. I'm excited to be here.
Well, I'm so glad to have you here too. I've interviewed a lot of people on my podcast. Mainly they're in the healthcare industry as a provider, as a doctor or a myofunctional therapist, or physician, a dentist. But I think you're the first person that I've had that is in the profession, but that's not actually a provider. But what you do is so very important. So tell me a little bit about yourself. You live here in the Dallas area, right?
Yep, I live in a small town, Godley, about an hour in between Burleson and Cleburne.
Okay.
I've been a dental assistant, or in the dental world, for 12 years, but the last 3 of those years I was actually teaching dental assisting at a local career college, and I absolutely loved it. I found my calling. I was going to retire doing that job. Mm-hmm. There was nothing that could get me to leave. Mm-hmm. But it was around that same time I had just recently lost my mother to sleep apnea. And I had a few friends that worked for Vivos, and they had reached out to me a couple times about possibly me joining the team. And each time I politely said, no, I'm so happy. I don't really know what could get me to leave. And they said, well, how about just helping us on the side? We have all these courses. We need someone to watch them and write some tests, and you can do it on the side. And I said, okay. And so I started watching and learning. Even though sleep apnea had been such a big part of my whole life, I had never heard heard it from this point of view. And so I said, sign me up. What do I do here? I want to come be a part of this mission.
That's awesome. And I failed to mention, Vivos trains dentists to identify sleep apnea and other sleep-related breathing disorders, and not only treat it from a standpoint of helping people sleep better, but helping them breathe better and actually curing, or not curing, but reducing the symptoms of obstructive sleep apnea. So today, I had Brianna here because she is I said Brianna, I'm sorry.
Okay.
She likes to go by Bri. It's like, my real name's Harold, but if you call me Harold, I won't even look at you. She has an amazing story. As she said, your mother passed away from sleep apnea. So, and you have 2 children, right?
I do.
So how old are they?
6 and 4.
6 and 4. Okay. And let's not discount the other person that's responsible for those children. What does your husband do?
He is a trim carpenter, so he does all the pretty stuff.
Okay. Yeah. Well, my dad was a carpenter. My dad built houses, so I grew up around that. So I love that stuff. I learned so much from my dad. My brother actually followed in his footsteps and does that too.
Oh, that's awesome.
So so I could talk to your husband for hours.
Yeah, and he could talk back.
Maybe I'll have him on my podcast.
Yeah.
So you have 2 young children. Let's go back. You talked about your mother dying of sleep apnea, but this was something that you guys kind of saw coming. You just didn't understand the complexities of it at that time, right? Or would you just start your story? Just go back to
I remember
the beginning.
I remember I was a young girl when she was diagnosed. My mom could fall asleep at a drop of a hat. So at this time, she was relatively healthy. She looked similar to me. She didn't have any other issues going on, but she could fall asleep anywhere and everywhere. When would she? I mean, you caught her doing that? Oh, yeah. And when we would drive, we always had to have a passenger in the front seat because she would do those dips and we would grab the wheel.
Yeah. Wow.
A lot of very embarrassing school functions with my mom in the audience sleeping. And in fact, this is what got her to get tested. Was she was a pharmacy technician, and she was very proud of that. And she worked at the hospital, and she loved her job. And part of her job is to put medicine in this machine called a Pyxis, and you fill it up on all the different floors. Well, twice she fell asleep standing up over this machine.
While she was doing that.
Yeah.
Oh, my.
And so, of course, I mean, she had to unfortunately lose her job, and she got tested and found out she had severe sleep apnea. And the machines are still terrible today, but back in the early 90s, I mean, it was huge. It didn't sit on the counter. It was on the floor. It was a big machine, and my dad couldn't handle it, so he slept in another room. But that was so normal to me. And, of course, so that there's a free spot next to my mom, so I slept next to her probably way too long. But, yeah, that was kind of just the beginning. It just started as that. Now she just wears the CPAP machine. But then it just progressively got worse as the years went on.
Because she was having not only, and this is the same with anybody with sleep apnea, they don't only struggle to breathe when they're asleep. They struggle to breathe all day. It's just not as bad because they're up and they're moving around. Your mother, though, was, and probably not unlike a lot of people out there, but her breathing during the day, she even struggled to breathe during the day, right?
Yeah, and it didn't necessarily start out that way, but as the years went on, she eventually was on oxygen full time. And walking from the bathroom to the kitchen would wind her. And she always had to plan out where she was going because she just couldn't breathe. And we eventually had our doctor keep a pulse ox on her finger, and we would monitor it. And because her body was so used to being deprived of oxygen, if she was sitting here with us today talking and she had it on her finger like she often did, it would easily say 80, 84.
Yeah, wow.
And you would look at her and she seemed so comfortable because if that was me, I would, be calling an ambulance. But her body just got so used to functioning on such low oxygen.
Yeah, and it's funny. I was talking to my trainer yesterday about doing cardio, and we're talking about how the human body, the way God made us is the human body is very capable of adapting and becoming very efficient with what it has. And we're, talking about, I used to run, 8 or 10 miles a day, 4, 5, 6 days a week. And you finally get to the point where that is not even a problem at all. You don't even get winded because your body can adapt. Well, just as your body can adapt to that, it can adapt to being low oxygenated, but it catches up with you. That's not healthy. When we do a sleep study on our patients, if their oxygen saturations get below 93%, that's a red flag. Certainly when they get into the 80s, it is. And your mother was living day to day at that kind of saturation of less than 90% in the 80s.
Yeah, it's I would say the last 3 years of her life were the hardest. So by that point, she now developed diabetes, heart issues with her heart. And then do you want me to kind of go ahead and talk kind of about her passing and how that happened?
Yeah, sure. Yeah,
okay.
That's very relevant.
Okay, just make sure we're ready for that. So I remember the first time my sister went over to check on my mom for whatever reason, and my mom her coloring was really off. She looked blue. My sister, shaking her to get her, arouse her, wake her up. And then my mom started talking crazy. So my mom started talking, but she was not making sense. She was saying words, but they were not forming a sentence. So we called the ambulance. They don't know if she's having like a diabetic episode or what. They rush her to the ER and they do blood work, and her CO2 levels were, the way the doctor explained it to us is they were at fatal levels. Like, I don't know how you guys got her here. And it was really scary. So they put her on BiPAP. So now my mom, not only is she not breathing, but she's not pushing out the bad. And so having such high levels of CO2, she was delirious. Like, it was almost like it was poisoning her. And so she spent a week in the hospital on BiPAP. They put lots of antibiotics and steroids, and they got her healthy enough to come home. But then that kept happening. So we kept having these moments where we were lucky enough to find her, but had we had been just a couple minutes too late, she wouldn't be alive. And she had her sleep apnea machine on. Like when my sister would go over there, it's on, it's working, but it wasn't at that point doing the job anymore. Yeah. Wow.
And you told me something last week that has just kind of stuck with me, what your father would say to your mother over the years. What would he say to her?
He'd say to her, and also does, he didn't want to find her. Is that what you're mentioning? Yeah. He didn't want to be the one to wake up one morning and find mom gone. And he would tell us kids all the time, and he's a real sensitive man. So if that kind of gives you a little bit about his personality, but he would beg us, please don't make me find her, because I won't recover from it. And so that was just, once those episodes started happening more frequently, we all kind of lived in fear. We just didn't know when that day was going to come, that we weren't going to get there in time. But so the last time it happened was right around the time COVID was still new and scary. So she was in the hospital alone because she couldn't have visitors this time. And she was really scared that something would happen to her and we couldn't be at the hospital with her. And so she actually asked to come home early. And the doctor said, you're not well enough. Like, if you go home, you will not make it. And we had a family meeting. Are we going to let mom do this? But she told us, she said, I've been fighting to breathe my whole life. I'm done. Like, I don't want to do it anymore. And so we let her come home. And she passed away shortly after that. But
how old was she?
59.
59. Okay.
Yeah. So that to me is, a few years ago, I would have thought that was old, but now now I'm like, wow, 59. She's so young. Yeah. And just the quality of her life too. Even making it to 59, the quality of those 59 years were so low.
Not good. Yeah. So she, even as a young child, she was like this. How old was she when you were born?
I think she was in her 30s or like late 20s when
So
I was
you
born.
remember growing up as a young child and witnessing all that. I mean, I
Oh,
know
yeah.
you said like at school functions she would go to sleep, but that was there from day one for you with your
Right.
mother.
Yep. And it was
Yeah.
really scary because, I think my parents did shelter me some, but kids are smart and they listen to conversations
Mhm.
and hearing things like my mom telling my dad how many times she stopped breathing at her last sleep test. Like kids hear those things and it's really scary to kind of witness that and to see her struggle, and also to have her surrounded by so many medical doctors. Like she was lucky enough to know she had sleep apnea, which most people don't. And so she was being treated, but she was just getting worse.
Yeah.
So I'm just like,
I wonder do you know if she ever was tested for centralized apnea? Just for our listeners,
Yeah.
there's obstructive sleep apnea, which is the majority of people have, and that just means that the airway from the nostrils and mouth down, into the lungs, there's some restriction here. And so when you go to sleep at night and you go into deep REM sleep, that will collapse and you go into an apneic event. But there is a sleep apnea called centralized sleep apnea, and that's more of a central nervous system disorder. And you can have a combination of both, of course, as well. Do you remember what your mother's diagnosis was?
I don't remember, but I know they would have checked for that. And in fact, I called my sister yesterday and I was asking because I wanted to bring some of my mom's sleep tests. And I have more of an interest in them. And she said that she knows her doctor. And so she's going to try to see if they would give them any of her records, but I don't know. I'm pretty sure it was just obstructive though.
Yeah.
I'm almost positive, but I have been trying to just get those documents just out of curiosity to see them with new eyes.
Yeah, it'd be interesting to see that. Yeah. So when did your mother die?
It'll be 2 years in August.
2 years. Oh, so it's still really fresh.
Yeah.
Yeah. Okay.
And
do your kids, let's say, how old are they again?
6 and 4.
6 and 4. So the 6-year-old probably remembers.
He does. Yeah.
His grandmother.
He does. And she went by Meemaw.
Mm-hmm.
She was their Meemaw, and she had a scooter because she, could barely walk. Right. So she would take them for scooter rides, and that was kind of like their special thing. They looked forward to that, and
how sweet.
Rode scooters around, and so they'll remember her, and we'll do a real good job of keeping her memory alive and talking about her.
Yeah. Well, what you're doing now, with Vivos, what are like on a particular day? What will you be doing?
So
I know you help with education.
Yeah, so the director of continuing education. So a big part of how we educate dentists is through giving out CEs, continuing education, and we have to be approved to do that. So I maintain our approval. So
I know that story.
Yeah.
At the teaching center, we have to do that. And
I just renewed
our executive directors. That takes up a big part of her time.
Yes, and so I just renewed ours, and that was a big feat. And so, also just talking to doctors who are just getting interested in airway and a new way of treating patients, just kind of talking to them at the events. My mom doesn't always come up, but I love talking about her. So if I can slip it in, I do. And just help putting on education to get this and out there. And that was a big part for me of meeting providers like you. I've never heard providers talk so empathetic and loving about sleep apnea. So that is a big guilt I'm still struggling with, is my mom was always treated like, you're overweight and this is your fault, and if you would just diet and exercise, you'd get better. And she was never treated lovingly.
Yeah.
I had this thought driving over here, and I thought, if a child was born and their feet didn't develop properly and so they couldn't walk, you would never, tell them, oh, it's your fault you can't walk. You would just be so sympathetic to their disability.
Exactly, right.
And my mom's airway and arches didn't develop properly. And so we should have treated, even myself being her daughter, I wish I could go back and treat her with a little bit more empathy of, I know why you're suffering. And that's just been a big part, is working with such incredible doctors like yourself that have such a love for their patient and they see the patient and what I wouldn't give to be able to have my mom hear that. Or,
Right.
I
Sure,
wish it was 2
absolutely.
years too late, but I wish I could tell her, and give her that. I know
Right.
why this is
Well,
happening.
it's so easy for us to once I started treating this and learning about it, I realized, I would have a mother of 4 that has sleep apnea, and they're frozen. She can't move forward because they she her state of anxiety is from her sleep apnea, and then that anxiety carries over into, well, then she's overwhelmed with her kids, so it's just hard for them to make decisions. And I used to be, I'm not overly judgmental, but I would, I can't believe that, I might have said, I can't believe this, she wants to be healthy for her kids, but then she won't move forward. Well, a lot of times they can't. They're frozen. It's because of their medical condition, or like in your mother's case, when people have sleep apnea, their cortisol levels stay really high, so it's really hard for them to lose weight because they can't sleep, they can't breathe, and so the cortisol levels stay high. Then they gain more weight, and then it's just a vicious cycle. And it's so easy for us to say, well, if they just diet and exercise, yeah, that's good. We all should do that. But it really does make you much more empathetic to people.
Yeah.
And seeing why they can make some of the decisions they make, good or bad, because of their medical condition, which kind of like that's a great analogy, because you don't see sleep-related breathing disorder. You don't see that. You see someone that might have an arm cut off, or a child with little nubs for feet. Oh, look at that! Look at how they're struggling to walk, but they're doing it, and it's you're encouraging them. But with sleep-related breathing disorders, sleep apnea in specific, you don't see it, and it happens to not only people that are adults and overweight, but it happens to young children. I was in my last podcast. I opened up by talking about some of the kids we have in our practice that are 7, 8, 9 years old that have sleep apnea. They're on CPAPs as little children because their airway didn't develop correctly, and that's no fault of their own. And so, it's people like your mother and people like you who learn from it. My father, I shared with you, died of Parkinson's, but he had severe sleep apnea. So even though his death, it doesn't have anything about sleep apnea on his death certificate, I have no doubt in my mind his Parkinson's was brought on by years and years of his oxygen saturation. I'm sure staying in the 80s when he slept, because he would go into, 30, 40 apneic events an hour, and he'd stop breathing and then start gasping. So it's when we have a personal story like that, it makes us more empathetic, much more empathetic, and want to help people.
I was going to mention her dad, my papa, passed away at 45 of a sudden heart attack. And
you told me that.
Yeah, so now I wonder if it all links together, and how it all fits in there. And she really fought. I mean, she tried. She had her uvula removed. She had different surgeries. And I think back to, I remember her getting diagnosed when she was still relatively healthy, and she just had excessive daytime sleepiness. And I think, man, if we would have intervened right then.
Yeah. And that really is just to delve in a little bit more to what we're doing with the doctors in Vivos and there's other organizations out there that promote this type of treatment too, not just Vivos. Vivos is the biggest one, and they're very, very well organized, and it's a great company. But we know that people that wear CPAPs, their condition can, and it's been shown to slowly degenerate, because you kind of gain it's not that the CPAP doesn't work anymore, but it kind of makes your body lazy. And so that flaccid tissue that used to collapse, now the CPAP is holding that open, but it just gets more flaccid. And so it gets harder to breathe as you get older. And I don't want everybody out there on CPAPs to quit wearing them. You should wear your CPAP. But what we're doing now, and the company that Bri works for, and the company for whom I'm a clinical advisor, we're if we can intervene, especially early, when in the young children or teenagers or in their 20s or even in their 30s or 40s or 50s, just intervene whenever we can actually, with an orthotic therapy, we can actually expand their airway and permanently, not just while they're sleeping. And this treatment can profoundly reduce the effects of sleep apnea. So I'm proud of you. I'm proud of that you left a job that you loved and that you were on top of the world, and you took a chance to do what you're doing, because what you're doing is extremely significant, and you're going to make a huge difference, not only in this company, but in the world as well. You're good, even if one life is saved because of what you did, it's worth it.
Thank you. I appreciate that. And I started out, when I first started learning so much about airway and these amazing doctors, I was angry at first because I couldn't save my mom. But now I'm just so passionate about saving somebody else's mom.
Yeah.
Because, or brother or sister or child. And so I appreciate that.
Yeah.
And thank you for giving me the opportunity to come and share it.
Oh, you're more than welcome. Thank you for sharing.
Thank you.
Not everybody will share such an intimate, story like that. It's so close to your heart, but I appreciate your bravery in doing that and knowing that you're going to help a lot of people. So as we always do, we're going to wrap up now. And you picked an interesting song. I love the song you picked up because I'm a singer and I love country music. So Alexander and I were talking, there has to be a personal story here with this song.
There is.
So why don't we listen to a part of the song? Ziggy, you got that pulled up? Okay, let's listen to it, and then just tell me the name of the song and the artist.
Don't Take the Girl by Tim McGraw.
Okay, let's hear some of it.
Johnny said, take Jimmy Johnson, take Tommy Thompson, take my best friend Bo, take anybody that you want, as long as she don't go. Take any boy in the world. Daddy, please don't take the girl.
Okay, Don't Take the Girl by Tim McGraw. Some people said that's kind of a sad song, but it's also a very sweet song as well. I think a lot of people could relate to something like that. So tell me.
So 90s country in general takes me back to, it makes me feel at home, my childhood, cleaning the house, CMT on the, TV, and there's this nostalgia and comfort from 90s music, 90s country. But this song in particular, I picked it because it's one of my mom's favorites.
Oh, okay.
And I'm getting
I told Alexander, I said, I bet that was one of her mom's favorite songs.
Yeah, it's getting me emotional right now because I'm a sensitive person, as you can tell. And I come from two very sensitive parents that often cried and, were just very easy to, they're quick to love and quick to, get emotional. And so this song, no matter when it played, my mom would cry every time she listened to it. And I remember thinking, how funny, this song, it's however many years old, she can listen to it 1 hour, 2 hours later, listen to it again, she will cry again. It's like it had this power over her. And then one day I was driving in the car, and this is after my mom passed, and the song played. And of course I'm bawling, and my husband's like, it's a sad song, but it didn't warrant the kind of tears I was given. And I just said, it's so funny. It's like, I get why, it just was sweet that she had such a big heart. And so she'd get, teary-eyed pretty easily. And so I think of her every time that song comes on, because I can picture us in the car and it playing and her getting emotional. And so that's
and that's why we do, and that's why we call this Health in Harmony, because I love music. I'm the same way. I can hear there's certain songs that I can hear that the song itself, while being a great song, it's the memories associated with that song with who I was with, or there's several songs that remind me of my mother and my father. So I understand completely. So that's what it's all about. We want harmony in our life. We want harmony in our body. And music is a big part of that. So, and breathing is a big part of that too. So that's kind of a natural for this to fit together. So if you were going to look into that camera out there and just talk to the people that are listening to this, that if they have a loved one that might be, suffering from this, or even if they might suspect it, what would you tell them?
I would say get tested. It's so easy just to get tested. Just start by knowing what's going on, and then get treated and fight for your loved ones, because we want you here. I wish I was still driving in the car with my mom listening to 90s country. She was an incredible person, and she deserved to be on this earth a little bit longer. And so your family needs you, and if it's not yours, when your loved one is suffering, it's really scary. So get treatment, look into your options, search for incredible providers like Dr. Stewart that have such love and empathy, and just do it. I think that's all I can say is just do it, because we need you here. We need you healthy. And you just got to start as soon as possible, and your whole family. And because even if you don't think you have sleep apnea, just double check. Be sure, because it
better safe than sorry.
Yeah.
And it's so easy for those of you. And I don't have this podcast to promote my practice. So regardless of where you live, if you want to know someone to go to or how to get started, you can just look us up, the Stewart Center for Optimal Health, and give our office a call, and we will find somebody for you in your part of the country. If you want to come and have us, a home sleep test is very easy to do. It's not expensive, but there's great organizations like Vivos. So you can go to vivoslife.com. I believe that's the website now. And they have a list of providers. The Breathe Institute with Dr. Sarush Zaghi on the West Coast. You can call TBI or the Breathe Institute, and they'll find somebody for you. But just get tested, have your loved one get tested, because like Bri said, we want you here among us for as long as we can have you, so or your loved ones. So don't put it off, and you'll be glad that you did. So Bri, I want to thank you so much for being with us today. I'm going to give you a hug here.
Oh,
Thank
I'm
you.
a little sweaty now.
Well, this has been Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart. This has been an amazing episode, probably my favorite, if not one of my favorites, if not my favorite episode so far. I know this is going to change a lot of people's lives. So Bri, thank you so much. We will see you guys next time. In the meantime, be healthy, be happy, smile at someone today. You may be the only person that smiles at them. Say something nice to somebody, because everybody walking around has got something. You don't know what's going on in their life, and you might be that person that can change their lives or just change their direction for that day. So you guys take care. I'm signing off. Dr. Hal Stewart with Health and Harmony Beyond the Teeth. Bye-bye.